Hello friends, good morning to all of you. So I am back with another video on sociology optional subject for UPSC SCE means examination. In this video we are going to cover population dynamics, the next topic of emerging issues, that is sex ratios, child and infant mortality and reproductive health. So friend, please do these 3 hours. It will really motivate me to continue this awesome course and share as much as possible so that more and more people will get benefited. Comment and like the video and ask any doubt if you have, and hit the subscription button below the video as hard as you can. And now you can also follow us on FB page, that is facebook.com/unorthodox academy. So friend, as you know that we are covering slot 2 autonomous topics. We have already covered this much, and by this video we are also going to finish population dynamics. Then we move to the paper 1, that is social the discipline. So friend, first we see the sex ratio. Basically sex ratio is defined as the number of females per thousand males in the population, and this information is an important social indicator to measure the extent of equality between males and females in a society at a given time. The sex ratio in the country has always remained unfavorable to females in India. So basically we can see it from here also, that is in the census of 2011 there is only 933 females per thousand males, and in 2004 there is a negligible increase which has 940 females per thousand males. So basically we see sociologically or from the aspect of social life, including the ability of sex ratio as a aspect of social life, including the availability of potential marriage partners and the composition of labor force. So basically Kerala has a sex ratio of 1080 females per thousand males, which is appreciable. Then Puducherry has also 1038 females per thousand males, while Delhi has only 866 females per thousand males, which is a concerning issue, and Haryana has just 877 females per thousand males, which is also a concerning issue. Then numerous factors like maternal mortality, immigration of males, and high rate infant mortality for girls are given for this sex imbalance in the country. Then major reason lies in culturally sanctioned negligence and apathy towards the girls. Basically she is discriminated against even before birth in the form of feticides, and she is also compelled to live a life of deprivation, ill health and exploitation. So sex ratio is not in good condition in India, so it's a concerning issue. So there are many schemes or efforts by government which is given in this video, which describes about penalties in unfavoring sex ratios and the birth determination of sex. So this is a government site, that is of Press Information Bureau. So please go watch this site there. I will also give this link in the description below. So now we see the child and infant mortality. Basically infant mortality refers to a death of young children, that is typically those are less than 1 year age. It is measured by infant mortality rate, which is the number of death of children under 1 year of age per thousand live births, whereas child mortality, which is also known as child death or under 5 mortality rate, is the number of children who die by the age of 5 per thousand live births per year. So what are the reasons? Basically the reasons of death of children under 5 include pneumonia, preterm birth, diarrhea, malaria, malnutrition, and there is also not availability of vaccinations to the some birth. But India has already launched universal immunization program which covers these issues. Then there is also causes of infant mortality, the first sick birth defect, preterm and low birth weight, which is due to the malnutrition of females giving birth. Then sudden infant death syndrome, then pregnancy complication is also important, and then there is malnutrition, and the main factor which we see sociologically is gender favoritism. In this, as you know that by gender favoritism, the girls ratio, which it directly affected the sex ratio in India. Then these are the data which is from the Niti Aayog which is a government website, and please check out this links also. I will give these all links in the descriptions, and there is also a link of PIB which gives you the data or the accurate data related to child and infant mortality and maternal mortality too. Then the important thing is reproductive health, which is also included, or we can say is a part of population policy and family planning. So basically, what are problems and strategies to this? So now we check out this. Basically, India was the first countries in the world to initiate action plans and programs at a national level to attain total productive health as a social goal. These programs, called family planning, and were initiated in 1951 and were periodically assessed over the past decades. Improved programs covering wider reproduction on related areas are currently in operation under the popular name Reproductive and Child Healthcare, that is RCH programs, creating awareness among people about various reproduction related aspects and providing facilities and support for building up a reproductively health society are the major tasks under these programs. When, with the help of audiovisual and the print media, government and non-government agencies have taken various steps to create awareness among the people about reproduction-related aspects. Then parents, other close relatives, teachers, and friends also have a major role in the dissemination of the above information. Sociologically, introduction of sex education in the school should also be encouraged to provide right information to the young so as to discourage the children from believing in myths and having misconception about sex related aspects, which is more prevalent in Indian society. Then we have proper information about reproductive organs, adolescence and related changes, safe and hygienic sexual practices, then sexual transmitted disease, that is STDs, AIDS, etc. And these would help people, especially those in the adolescent age group, to lead a reproductively healthy life, and educating people, especially fertile couples and those in marriageable age group, about available birth control options, care of pregnant mothers, postnatal care of the mother and child both. Then there is importance of breastfeeding, equal opportunities for the male and female child, etc. And these would address the importance of bringing up socially conscious healthy families of desired size. Then awareness of due to uncontrolled population growth and social evils like sex abuse, sex related crimes, etc. need to be created to enable people to think and take up necessary steps to prevent them, and thereby building a socially responsible and healthy society. Then there is also successful implementation of various actions plans to attain reproductive health requires strong infrastructural facilities and professional expertise and material support, which is a requirement of infrastructure in India, and these are essential to provide medical assistance and care to people in reproductions related problems like pregnancy, delivery, STD, abortions, contraceptions, menstrual problems, infertility, etc. And the implementation of better techniques and new strategies from time to time are also required to provide more efficient care and assistance to people. Then there is a statutory ban on amniocentesis, a fetal sex determination test based on the chromosomal pattern in the amniotic fluid surrounding the developing embryo. So basically by this, as you know that the government has banned the pre-birth determination of sex. So this is for this and for sex determination to legally check increasing female fetus size, which imbalances the sex ratio, and massive child immunization, etc. are some programs that merit mention in this connection. Then research on various reproduction related areas are encouraged and supported by governmental and NGOs to find out new method and or to improve upon the existing ones, like a Saheli, a new oral contraceptive for the females, which was developed by the scientists at Central Drug Research Institute CDRI in Lucknow, India. Then better awareness about sex related matters, increased number of medically assisted deliveries and better postnatal care, leading to decreased maternal in 2015 and infant mortality rates increased number of couples with small families, better detection and cure of sexually transmitted diseases, and overall increased medical facilities for all sex related problems, etc., all indicated improved reproductive health of the society. So thank you guys for listening to me and watching this video. Please do these things, and now you can also follow on us FB page, which says www.facebook.com/unorthodox academy, and hit the subscription below the video. Thank you.